Welcome to Doctors on Call. I'm Jenna Miller. Pet owners spend more than $65 billion on their pets every year in the United States, according to the American Pet Products Association. Nearly 80 million households own at least one pet. Of those owners, at least half of them buy gifts for their furry friends, whether it be for Christmas, their birthday, or just because they love them. It's no wonder when your pet shows unconditional love and rarely asks for anything in return. But how can you assure you give your pet the best life they deserve? Joining us tonight to answer that question will be veterinarian Dr. Brandon Weidenhaft.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Camco, the state's only Kansas-based medical liability provider, serving medical professionals and advocating for the health for all Kansans.
Russell Regional Hospital, experts, neighbors, friends.
Your family is our family. Staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in North Central Kansas.
Pet health is our topic this evening on Doctors on Call. Please take this opportunity and call 800-337-4788 with your questions. Dr. Brandon Weidenhaft graduated from Kansas State University College of Veterinary Medicine in 2001. Having grown up in western Kansas, Dr. Weidenhaft was excited to return to the area and has been practicing in Hays for the last 12 years. On September 1st, 2012, he opened his own mixed animal practice, Big Creek Veterinary Services. Doctors on Call brings you information which may be useful to you when you see your own physician or veterinarian. Thank you so much for joining us tonight. Let's go ahead and get started with some questions. We're going to kick it off with a couple of questions that were emailed to us. And this first one comes from Jessica. She says, my dog Holly is a spayed 3-year-old miniature Schnauzer Yorkie mix. Holly was recently diagnosed with stage 2 laryngeal collapse and GERD. Has a history of skin allergies, and I use an antimicrobial shampoo. She's currently taking Pepcid twice a day and is on a probiotic. She's primarily interested in treating her GERD and didn't know if she would require more than one medication for that. She's been recommended for 2 different kinds of medications, but she's wondering if there is anything that they could pursue if needed for potential allergies. She's interested in any potential holistic options and possibly a new fresh diet that might be better for her as well. So what kind of advice do you have for Jessica?
Well, first off, when she says GERD, she's referring to gastric reflux. In case you're not familiar, somebody's not familiar with the term. She has a problem with acid reflux that's coming back up in the esophagus and causing, some sort of discomfort. So it says she's been taking Pepcid. That's a common treatment. It's an over-the-counter medication. That's a good place to start, and that will help with that gastric reflux. There's a few other things that can be done, but that's a common place to start. Talking about the laryngeal collapse, so kind of unrelated to things, all within the throat area. So, some dogs, when they get excited, the tracheal rings that hold the airway open, actually, they get excited enough, they breathe hard enough that it collapses in a little bit as they inspire, as they breathe in. And so it will cause a cough or maybe like a kind of a snorting sneeze kind of thing. So that is an annoyance, but not necessarily a life-threatening condition. The reflux is also going to be an annoyance, but it could potentially lead to some other things that might, cause long-term health effects. But as a 3-year-old, it's probably still in that stage of more of an annoyance issue. So treatment-wise, I think that they've started at a good spot. Talking about using antimicrobial shampoo for skin allergies, also a good place to start. There are medications, and I see down here that she mentioned something about using Apoquil. And Apoquil is a common kind of anti-itch medication. It It kind of is sort of like an immunosuppressant. It just dampens that allergic response that's making their skin get itchy. She's concerned about long-term health effects from taking Apoquel. And yes, there are, but sometimes you got to look at the fact that the benefits outweigh the risks. And so that would be, a situation where, without, seeing exactly what her skin condition is like, Apoquel on a like a month-by-month basis might help very much. Also, there are some other long-term injectables. One's called Cytopoint, and it lasts about 3 months from one injection. It works in a similar manner as the Apoquel. They both just kind of help that immune system and how it deals with the allergens that create the itchy skin and that sort of thing. So, yes, long-term effects are possible, but some of those allergens are seasonal. So like for maybe 3 or 4 months, they're bad, but then they subside. Change in season, change in weather patterns, moisture would help. I mean, we've really been in a drought situation, and we see a lot of itchy dogs now. And I think that if we would just get some good rains, get some, as spring approaches, some green grass and some of those things, I think would help some of our allergen problems that we're experiencing with our pets. So, I don't know if I've answered the question thoroughly, but it's a lot of question for, a few minutes time. But,
Sure.
but
She had mentioned the holistic, if you had any
so,
holistic ideas.
Holistic options, the food and a fresh diet, I don't, without seeing the pet, make recommendations of a specific type, but holistic medicine is using kind of what's thought as alternative a little bit. So like chiropractic and acupuncture, nutrition, aromatherapy, those are all things that kind of fall into that holistic category. And so, diet is an important thing when it comes to having problems with skin and allergens. So sometimes by changing it up, and most pet foods are going to contain chicken, wheat and wheat byproduct and those types of things. So sometimes by getting away from those more common ingredients and getting into a novel ingredient, you can find some that have got like duck and potato ingredients and things like that. Sometimes you can avoid some of those allergens by changing their diet. So, a lot of things to look into there, without knowing exactly what diet she's on currently and what has been tried there. It's a little hard to make a recommendation on what's new or what's been, to try, but maybe they've already tried it. So I hope I answered that question to her satisfaction, but there's a lot of questions. So
Sure. Now you mentioned chiropractic. Can you take your pet to the chiropractor?
sure, absolutely. So in the state of Kansas, they do need like a referral, but there are some veterinarians who practice chiropractic medicine. I'm not versed in it very much because it's become more popular after I got out of veterinary school, and so there are some around that do perform chiropractic adjustments, and there are some human chiropractors who have done some adjustments on pets. There are some locally that I have contacted and have sent things to, and so it does make a difference sometimes. So, but it's a niche market. There's people practicing it. So,
Excellent. Okay. We're going to move on to our next emailed question.
Okay.
We have the next one says, we have a Great Dane that is 7 years and 2 months. My daughter looked how old is the oldest Great Dane in the world, and it said a Great Dane called Freddie, who is 7 years and 8 months and is still living. We are wondering how old the oldest Great Dane that you know of.
okay, so I've had Great Danes as clients and patients that have made it to roughly 10 years. And so I knew that question was coming, so I Googled it, and there is a dog named Maggie May that is listed as making it to 16 years old as a Great Dane. I think that is kind of the exception, not the norm, but I think at 7 I wouldn't be stressed about end-of-life issues yet. I think that probably could have a good long life yet ahead of her. So.
And why do those larger dogs sometimes don't have as long of a lifespan as the smaller dogs?
Well, I think a lot of it's got to do with metabolism and just they lots of different factors. Some can be genetics, some can be just like metabolic processes, and you know those bigger dogs tend to just wear out more quickly. You know, they just their bodies just don't cope as well. So time catches up more quickly with the bigger breeds.
Okay. I did want to touch on Jessica. She had mentioned using the Pepsid.
Sure.
Is that Pepsid that you just buy at the store for humans,
Yep.
or is it a certain kind?
Nope, it is. It's over the counter. You can buy it at Walmart or Walgreens or GNC or, you know, Dillon's in the pharmacy aisle. I'm certain using the human Pepsid, which I believe is omeprazole. I could be incorrect on that one, but yes, they're talking about over the counter human medicine. So.
And do you advise your patients or clients to self-diagnose and use it on their own?
You know, self-diagnosis is, I would probably say no, I don't recommend that, but there are sometimes when, you know, there are things that you can purchase over the counter as inexpensively as purchasing them from me, or maybe even less expensively. One of the things that comes to my mind is glucosamine and chondroitin. It's a joint supplement. You can buy that at Walmart, and it's for humans. I mean, it's labeled as a human product, and you know, if you got an old dog with hip dysplasia, it might help it out a little bit. So, you know, you can come to me and I can get you some medicine. You can get the same thing, probably a little bit less expensive by getting it someplace that buys in bulk, like Walmart. So.
Very honest answer.
Yeah.
All right, let's talk about how often you recommend regular wellness exams for your pet.
Okay, so we typically will do once a year wellness exams, and especially as they age a little bit, it's always good for those senior pets to be examined kind of on a yearly basis. Sometimes things crop up that we're not prepared for, and if we haven't seen them for a couple of years, then maybe they're a little bit behind the 8 ball when we get to them. You know, if they're 2 years old and they don't come in for 2 years, it's probably not the end of the world. But as they get a little older, kind of routine senior care, at least once a year is a good call.
Sure. And how soon do you recommend seeing puppies or kittens?
Typically, we see them at 6 weeks. That's about when most breeders will send them to their new homes. Our vaccination schedule for our puppies and kittens is 6, 9, and 12 weeks for kittens, and 6, 9, and 12, 16 weeks for puppies. And so we'll typically see them roughly at that interval until they make it to 16 weeks. So we get to see them when they're little, and we get to see them for vaccinations and that sort of thing. So typically, like our clinic, we do a free new puppy exam. So no matter how old it is, if they got a new puppy and they want it checked out, we do it for free and kind of establish, you know, as a client patient, and then we can, you know, get them started on a vaccination program or whatever. So.
And talking about vaccinations, how important is it to keep your pet on a regimen of vaccinations?
You know, lifestyle is kind of a factor there, but most dogs, the vaccines that we use, they get them when they're puppies, and then they get a yearly booster at that time, and then most of them get them every 3 years after that. So are we over-vaccinating? I don't feel like we over-vaccinate by spacing them out to 3 years. Some people ask about checking titers to see whether their dog really needs to be revaccinated, and we can do that. We don't do it in-house, we send it to a lab, but you can check titers. To be honest with you, it's about 3 times more expensive to check the titers than it is to booster. You know, I don't think we're doing long-term ill effects to our pets by boostering them every 3 years. You know, I suppose if you read the internet, you'd find people that say that's too much, but I just don't see it in person anyway, that boostering them every 3 years is overdoing it.
And explain what titers is.
Okay, so titers is basically checking to make sure that their immune response would be adequate. So the vaccine is still in their system, and that if they were exposed to a disease, that their immune system would still respond to it adequately. So yeah, I guess basically it's just making sure the vaccine is still there and working. So.
Sure. And how do you get around that? Like I would say, like city ordinances often will say you have to have
Right,
a
sure.
vaccination. How do they work
And
that out?
even if you check the titers, that's one of those things that the city ordinance is going to take precedence over that. And so like in the city of Hayes, they have to have a 3-year vaccine for rabies every 3 years. And so, you're still, in order to be, I guess, eligible for your city tags and stuff, you're still going to have a certificate that says you've been vaccinated in the last 3 years.
Okay, let's talk about something that humans unfortunately struggle with as well, but an overweight pet. How do you know whether or not your pet is overweight?
We use body condition scoring. It's on a 1 to 9 scale, and normal is right around 4 to 5. If you look at your pet, and it's a dog is the easiest place to start. If you're standing above them and you look down, they should have a bit of a waistline. Behind the ribs, there should be at least a little bit of a waistline. You should be able to palpate the dorsal spinous processes of the spine along their backbone. You should at least be able to feel them. And along the rib cage, we would like to at least be able to feel the rib bones. If they're prominent and sharp, then the pet is possibly underweight. If they're overweight and you can't feel those dorsal spinous processes along the backbone or the rib, and they've lost their hourglass appearance, then yeah, we're probably obese, and weight loss would be, at least beneficial.
Okay, we might touch on what to do as far as losing weight, but we right now are going to go to the phone lines. We've got Donna on the line with her question for Dr. Weidenhaft. Go ahead, Donna, with your question.
I have a middle-aged cat. She's about probably 8 years old. She's been spayed and had her shots, but in the last couple weeks she's been shedding her fur, and she has some really thin places on her, and I wondered what could cause it or what I could do for it.
There's a few different things that can cause them to shed their fur. Some of it is natural. Natural shedding will occur, especially on a house pet, because the pets that are outside, they go through seasons, but pets on the inside stay relatively normal. The daylight, because of lighting in the house, and temperature because of either air conditioning or heating, it stays so steady that sometimes they just go through kind of a molt. They just start shedding very profusely, and so they'll get areas of thinness. Another thing is thyroid function can affect their hair and skin coat, and so there's a possibility that doing a little blood work would indicate why she's having so much trouble with her hair, and so that might be something that would benefit her. One of the things with cats is adding a new pet to the home, whether it be another cat or a dog, or sometimes just a new person, will cause stress, and cats will do what's called self-barbering, where they literally under stress will chew their own hair out. Typically that'll be along their front legs, along the inside of their front legs, along their back towards their tail. In mid-back, they'll literally chew their hair out. So, having it examined would be a good place to start as to why she's shedding so bad. Maybe a blood test would help indicate whether or not there's an underlying disease process going on. And then knowing, like I said, whether there's any stressors at home, something has changed. I've had one recently where they moved to a new apartment, and the cat kind of was stressed by that, and more so than people realize. And so we, discussed it and did a little bit of a medical injection, and it helped alleviate some of that stress for the cat, and she did much better. So I hope that answers her question. So.
Excellent. Okay, well, we're going to go back to the phone lines. We've got Cindy on the line from Hayes. Hi, Cindy, go ahead with your question. You are on Doctors on Call.
Yeah, I've always been able to trim our dog's nails, but our rescue dog has black nails, and I really don't know how to determine where the place is.
Okay, so the best advice I can give for trimming a dog when you're not exactly sure where the quick is is to go slow and take just small amounts off. Another thing that you could do if your rescue pet will allow it is to use a Dremel tool with a spinning sand blade on it and just sand them down a little bit, and that way you can kind of monitor how closely you're getting. One of the things about the toenail is when you first trim off a little bit of it, and if you're a ways from the quick, it'll stay kind of gray and flaky, but as you get closer to the quick, it gets kind of black and waxy. And so if you approach that kind of where the color starts to change from flaky to waxy, then you know you're getting close to the quick. But my best advice would be to just do small amounts, and you may have to trim one nail multiple times, just tiny little bit each time. But if you keep working at it and be patient, you can kind of get a feel for it. And that's how I do it at work. So,
is there any truth behind you can move that quick back?
Absolutely. So if you trim them, if they've really gotten long, and you trim them the best that you can, and walk the pet on hard surfaces for like 2 weeks, it will push that quick back a little bit, like going for a walk down the sidewalk and that sort of thing. And then we can trim them back a little more, and over time get them pushed back to where we can get those nails trimmed off shorter. So it just takes patience. And
is it also true, I've heard really you should not be able to hear the clicking on the floor?
Yeah, I think as a rough estimate, that's if they're clicking on the floor, those nails probably are getting kind of long. Typically after we've trimmed a fresh trim, we hear comments lots of times, oh, we can't hear the clicking anymore. So I mean, yeah, that's a good way to, I guess, judge it. If you start hearing a lot of clicking on the floor, maybe it's time for a nail trim.
And why is it important to keep those nails trimmed back?
Well, there's several different reasons, but the most common one is that when they get really long like that, they can catch them in carpeting, or catch them when they go outside and that sort of thing, and they'll break off a nail or tear a nail, and then you have discomfort, maybe bleeding. So some dogs, as their toenails get really long, it'll actually start making their whole toe rotate over, and so then you can get into painful conditions with basically just misalignment of the foot. So, but
is there any importance in keeping the hair? I know some pets are more hairy than others.
Sure.
That the hair between the paws, or
sure.
Yes,
Stickers and plant seeds and things can accumulate in there. Mud can accumulate in between the toes and cause soreness. And by trimming that out of there a little bit, you can help eliminate the potential for getting sore-footed. Or you get those little grass seeds that'll penetrate into the foot, and sometimes you got to take tweezers and dig those out and cause some, it can cause bleeding and discomfort.
What about the flu? Can your pet get the flu?
There is certain types of influenza that dogs can get, cats as well, but humans can get like influenza A, that sort of thing, and that's one of those tricky questions. Yes, they can get the flu, but it's not necessarily the same common flu like humans will get. But saying that, sometimes we'll see that the kids have been home from school and they're not feeling well, and a day later then the dog isn't feeling well. So there's got to be a little cross speciation there, just because it's so common that it seems like the whole house has been sick and the dog ends up sick as well. So,
what kind of remedies are we talking?
It depends on kind of the symptoms that we see. Sometimes we need a few days worth of an antibiotic because flu in itself is viral, but sometimes it leads to secondary bacterial infections. Sometimes they just need a little bit of IV fluid, maybe an anti-inflammatory fever reducer. Pets can run fevers just like humans do, and so sometimes they just need a little fever reducer. And so we kind of go by what the symptoms we see are.
Okay, excellent. Well, thank you so much for joining us and being our guest tonight on Doctors on Call. That's Dr. Brennan Weidenhaft from Hayes. Next time on Doctors on Call, we'll be discussing chiropractic care. You can email questions for us for our next program at doctors@shptv.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Camco, the state's only Kansas-based medical liability provider, serving medical professionals and advocating for the health for all Kansans.
Russell Regional Hospital. Experts, neighbors, friends.
Your family is our family. Staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.